வாழ்க வளமுடன். Today we are going to discuss the scientific basis of Kayakalpa. As we know, in our Maharishi's teaching and our Sky Yoga's principle, Kayakalpa holds one of the major fort, and it's almost like a trump card when compared to any other groups or followings available. I'm going to discuss the whole Kayakalpa based upon Maharishi's teaching. And as I usually say, reading Vedas, getting some tips and tricks from Vedas is my hobby. I will try to get the maximum information from the Vedas, and I will heavily use my medical books and medical knowledge in understanding the science behind the Kayakalpa. First, we will link what is the relation between the Brahmanyanam, which we have already learned, and this Kayakalpa practice. We will try to understand the Kayakalpa principles. I'm not going to share the steps of the Kayakalpa, which will be taught by our assistant professors in the face-to-face sessions. We will dive deep into the science behind the Kayakalpa and how it can be applied for a human's good health and how the benefits can be quite long lasting. So the discussion will revolve around three principles: what Vedam and Vedandriyam says about Kayakalpa, what is the scientific
Recording
basis,
stopped.
and what is my understanding. If there is any mistake in this presentation, it is purely my mistake, because the Kayakalpa is a very pure, absolutely magnificent technique. It's only the human mistake in understanding it or explaining it to others. I will spend just 1 or 2 minutes about Brahmanyanam. I've already presented the science behind Brahmanyanam quite in detail in this forum, and you all have seen the recordings already. As I mentioned, Hubble limiter law makes a very important crux in understanding Brahmanyanam. According to the law, when you observe any stars far away, the stars are moving away from us and also away from themselves at an exceedingly speed. It is accelerating. So if you take it in a reciprocal fraction, you can understand that everything happened from one point. That's how the whole Big Bang theory and singularity came in force. We are now quite familiar with this picture. The black one is the Shaktikalam, where there is the Parampurul present with absolute knowledge, unlimitedness, etc. Once there are quantum fluctuations, the Shaktikalam starts and the whole Big Bang happens. And we can assume that this is the Andromeda galaxy, and Earth will be like a blue dot inside that. Why this is important? Any energy in the world, whether it's a sun's energy or moon's energy, we did a wonderful meditation by the Harihaya today. He has taken us through the various possible planets. The energy of the planet, the physicality, everything started from the singularity, which we call it as Shaktikalam, and that's why the Brahmanyanam is very important. In Kayakalpa, all we are doing is, number one, understanding that everything came from that single biomagnetism. Number two, making sure that the biomagnetism is appropriately positioned within the body so that we can win over our karmas, as we discussed in the last session, and also it will help us to maintain a strong, healthy mind and body. Number three, how to prevent the untoward bad effects of this energy, like diseases or aging or even the imprints. So we will discuss this in detail now. This is very basic. As I say, every discussion, if you have to understand, you should understand, and not only understand, you should behave as if you know about your physical body, which you are seeing me, your subtle body, which is the feeling, the happiness, the sadness, the freshness, whatever you feel, it is the subtle body, and the causal body, which is the Brahman, and you all have, even the animals have part of the Brahman. it is very microcosm to think it's a part of the Brahman. We can even think that we are Brahman, and this causal body links all of us to that ultimate Shakti Kalam Brahman. So in the Kayakalpa, the understanding is predominantly on the subtle body, so that the subtle body is the one where we are working our energies, and because of the subtle body getting the energies appropriately spread and nicely balanced, our reflection in the physical body will get better. And when you keep the mind in the causal body, it gives us the ultimate connection and unlimited source of the energy. That's how it works. We will discuss this further in detail. A person's excellent, strong, subtle body will reflect in the physical body. So physical body is like a reflection of our strong, nicely energy dispersed subtle body. I just want to take you through one of the Tamil film. I'm sorry for the audience who are not familiar with the Tamil films, but the concept is quite understandable for anyone. This film released, if I'm correct, maybe 4 to 6 months back. The name of the film is Claps. It's an English term. Claps is the one which is used to start the race, like 100-meter dash or something. Nowadays in the Western world we use the gun to produce the noise, but in the olden days they used to do a clap where the two wooden sticks were clapped together that produced a single noise, so that all the participants in the race have the equal opportunity to start and run. In that movie, the hero of the movie unfortunately has lost his right leg, as you are seeing here, because of a motorcycle accident. He is a sports person, and he suffers from a kind of phantom pain on the limb which is not there. It is known as phantom pain, and the limb which is not there, when he feels, it is known as phantom limb. This is a well established one. Being a doctor, we have come across it. Could be a phantom limb in the legs or hands or anything. Why this phantom limb sensation, where a limb is absent but the person feels as if there is a limb, happens, and why the phantom pain happens? Phantom limb and pain are the good evidence to say about the subtle body. So our subtle body is almost like our body. As you saw in the previous picture, the center picture where a person is sitting, the subtle body is almost mimicking the size, shape of the physical body. But the only difference is it is as good as we treat it with good amount of energy and good amount of equilibrium. So in a person who is living from birth, say till 30-year-old, his physical body is good and healthy, his subtle body is good and healthy. Like this movie's hero, if that person loses a limb in a very abrupt manner, it's the loss only to the physical body. But the subtle body find it very difficult to understand that the limb is lost. This is very, very prominent in the initial maybe 4 to 5 days after the surgery, that the patient will understand the limb is absent or amputated only by touching it or seeing it, because by the feeling they will still feel that the leg is still there. And then slowly the subtle body get trained and understands the absence, and the person will know that the right limb is absent even by the consciousness itself. So what happens in this particular film, unfortunately, is the hero gets a kind of a pain in the limb which is absent, which is a phantom pain. Phantom means something which is absent. And the only way by which the hero can get rid of the pain is he needs to keep a mirror in the place where the limb is absent, so that his normal limb is reflected in that, and the subtle body will start understanding that number one, the limb is present, number two, the limb is normal because he has no pain in his normal limb. When the subtle body understands that the opposite side limb is normal, no pain, functioning well, it gets into that calm situation, and hence the pain getting relieved. It is very wonderfully portrayed. This is usually common in only like 4 to 5 days early period. Slowly subtle body get trained, but unfortunately in this movie, this particular hero is suffering for quite a long time. It may be a story, but you can understand how the subtle body works. If you understand the subtle body in this way, so how we can improve, strengthen the subtle body by using our physical body. So physical body is the only tool you have. As I say, our mind, our body are our tools. Our subtle body is also our tool. And causal body, the Brahman, is the only thing you are. You should associate that whenever you are doing the meditation, and then slowly, like they say about Sagaja Nitra, where even in the normal life, in your driving, in your eating, when you're talking to your friends, when, for example, like a doctor seeing a patient, you will feel that you are a Brahman in every second of your life. That is the ultimate way by which the life should run. So the first aim is to strengthen the subtle body, but you can't strengthen it straight away. So you have to use your physical body to strengthen the subtle body. This is the science behind the Maharishi's concept of Kayakalpa. The energy what we are discussing is biomagnetism. If the energy starting from the Shakti Kalam has spread and formed the Big Bang, you can say that is just electromagnetic energy, because it has got electrons, it has got magnetism, the earth has magnetism, we know the North Pole, South Pole, etc. When the whole energy is present in a living being, biology, we can label it as a biomagnetism. It's as simple as that. So biomagnetism is the basis of everything. If a person has no biomagnetism, he is dead. And it is responsible for the integrity of the body. That makes your skin to be nice and elastic and hold the tissues inside and keep your body integrated. It creates homeostasis. Only the biomagnetism is responsible for the pulse rate, for the heart to pulse, for the breathing to happen by itself, even though they are all controlled by the pacemaker cells, which is more of medicine. But the pacemaker functioning is also because of the biomagnetism. Homeostasis is nothing but keeping everything in a normal manner. If there is an infection, we get fever. The fever increases the body temperature. The increased body temperature kills the microorganism. Fever settles down. The man gets freed from the microorganism. This is homeostasis. Anything pushing towards the abnormal values, we are pushing back to the normal value. That is homeostasis. It happens everywhere. It happens in human beings, it happens in animals, it happens in plants, everywhere. And prevents entropy. I wish to always introduce some good words which will be very helpful for you in case if you are explaining this concept to your friends or family members. Entropy, as we discussed once before, is the one where everything is heading towards entropy. For example, our earth slowly slows down. The revolution, if you say slowly, it slows down, but it slows down such a small rate. You can't feel that the earth revolution is slowing down in your lifetime or even thousands of years. And the sun is getting bigger slowly. Bigger is because the integrity of the sun is lost and sun is slowly getting bigger. And you may have studied in the geography or astrology or astronomy, the sun will slowly start engulfing the planets one by one. Closer to it will die first. So earth is standing third in line, but it will take millions and millions of years. You create a nice sandcastle in the beach, and then if you leave it as it is, slowly the sandcastle will be blown away by the air or the water waves, and that is entropy. If somebody is not occupying the house and comes back after say 2 years of holiday or something like that, the whole house will be full of dirt and even some plants growing inside the house. It is entropy. So everything is going towards entropy. So if you are not properly taking care of your body will also undergo entropy. That is aging. Your skin will go shrinking, your hair will fall off, we'll get baldness, and we'll get, say, for example, cancer or disease. And even if you're not getting into the disease like hypertension, diabetes, cancer, a healthy human being is also getting entropy and getting aged. If a person lives with a spectacular health, very good example is our Maharishi, 90 years, 100 years, and then has a very nice death, we say that that person lived a very healthy life and he had a very nice death without any bedridden problems or big diseases. But the whole problem is entropy. Even the normal death is also due to entropy. So here nobody can escape entropy. The body will certainly die. This body has come from Panchabhutam. The body will certainly go. Nobody can preserve it. Even if you do something like embalming and preserving it, you can do only to certain extent. Even if you create a wax statue in the Madame Tussauds Museum in London, even that wax statue will have only a certain amount of life. So nothing, even the whole earth, the whole universe has got entropy. But our aim is to keep this body as healthy as possible, so that till the last day of our life, we will have the enough energy to associate ourselves with causal body. We will have enough power to help the people around us. That is the whole reason behind understanding the entropy and keeping the body healthy. In Vedas itself, there are various sectors who don't believe in keeping the body healthy. I will say it's absolute foolishness. You should take care of your body. I had COVID, I think, around Christmas 2020. During that COVID, that 5 days, I can't do my regular practice. I can't do the Kayakalpa. When I do the Kayakalpa, I can feel that it's almost empty. It is nothing. It's like a blown out cycle tube, and nothing is happening. So I just resigned and had good rest, and I recovered in 4 to 5 days time. So you will know the absence of the energy biomagnetism only when it is absent. When it is present and good, we won't feel. That's why a healthy person will never feel happy. Only if it gets some health issues, we started feeling it. Okay, so it's very important that you should enjoy the normal health also and keep that up as much as possible. And you all know about chakras. It's very important to understand the chakras. Chakras belong to the subtle body. Even though when scientific people research, they always correlate one of the or every chakra to some of the physical body structures. Like for example, the crown chakra can be equated to like cerebellum, etc. The Agna chakra is equated to pineal gland and pituitary. The throat chakra is equated to thyroid. The Anahata chakra is equated to the heart. So we can physically equate it. Nothing wrong in it. It makes sense. But overall, this chakras belongs to the subtle body, and the subtle body is made up of thousands and millions of nadis. And in the Shiva Samhita, one of the document recently shared in our WhatsApp group, they have described 350,000 nadis, of which 14 nadis are important, of which 3 nadis are important, which we know: Shushmana Nadi, Ida Nadi, which is on the left side, and Pingala Nadi, which is on the right side. And this is one of the ancient picture which demonstrates like thousands and thousands of nadis, and we can easily understand this. And these are all the scriptures which explain how the nadis flows and how the organs were demonstrated. Believe me, these pictures were belong to 2000 to 3000 years back, even before Christ. So people have so much of knowledge in those times, and those were the very accurate portray of the subtle body inside or overlapping the physical body. Now, why Kayakalpa? Why we have to keep our subtle body strong and the physical body strong? The first reason is karmas. We have gone through the karma in the last presentation. Now you all well versed on what are the types of karmas, how to control karmas, how to win the imprints, etc. So this karma acts on our body through the subtle body. And say for example, by karma, if a person X is supposed to gain weight and end up having the problems like diabetes and hypertension, then the karma will act through the Manipuraka chakra, keeping the hunger on bit of a higher level, and so there will be more biomagnetism focused on the Manipuraka chakra, and the person will end up eating more and putting up weight. So that's how the karma acts through the subtle body, so that the physical body has get the disease and the whole unit suffers because of that. So it's through the influence of chakras. So if you understand this, you can prevent the aging and diseases, which we're going to discuss further. Why Kayakalpa is better than Karpam? Some people may be aware of the Karpam, which is a type of a medication. I think it's well known in Ayurvedic and our ancient medical treatment also. The main reasons are: number one, the techniques of preparing the Karpam in that authentic manner, and the ingredients which we need to produce the Karpam is slowly dwindling away. In the scientific panel in Aliyar, there is one doctor who is, no, I won't say believer, even I believe in Karpam, there's nothing wrong in it, but he practiced taking this Karpam. So there is a specific regimen that you need to take this Karpam for 28 days and a different one for 28 days. And so what happened is that at one stage they said for this month you need to take Oru idal tamarai. Sorry, I don't know the English equivalent of it. Oru idal tamarai. It's a type of maybe a flower growing in the forest, but unfortunately that ingredient is not there. So the people haven't got the Karpam for that month. And when you take Karpam, again a strict lifestyle has to be followed, which anyway Maharishi has given us, like Aindil Alavumurai and then sleeping well and doing the exercises well and everything, which is quite common sense. But the Karpam has got a lot of side effects, like for example, it may have increased metal, sometimes the gold there and mercury and gold can cause heavy metal poisoning. There are some notes that Purachi MGR, our previous Chief Minister of Tamil Nadu, had these kind of Karpams and he had a kind of heavy metal poisoning. But so there is a lot of very discrepancy and lack of confidence in the physical Karpam, and definitely it's not safe. I just brought in a Tesla car here because some of you may be driving it. You can understand that Tesla is a kind of a clean energy. There is no emissions. The same principle happens in the mixie or the grinder what we have inside our kitchen. So why they are clean? Because the electricity goes in, the job done, the residue or the emissions are as minimum as possible. So Kayakalpa works like that. We use the biomagnetism to appropriately spread and utilize and without any much untoward side effects. Deepaji has shared the Netflix video series, and if you see that how if we are not careful in handling the Kundalini, it becomes like a double-edged sword, and it's very important to know the correct thing and do the correct thing. So the Kayakalpam works by elevating your overall biomagnetism. The aim is to take it from the lower chakras to higher chakras. That's why during the procedure of Kayakalpa, you coordinate it with the inspiration and you believe that the energy goes to the higher chakras. The believing is very, very important. Without belief, nothing will happen. In that group which used Karpam also, when many of them didn't had the outcome what they said is you won't have baldness. Even if you have bald, you will have the regrowth of the hair. Your gray hairs will become black and your skin will get nicely smoothened and nicely elastic. So all these things we can reach with the Kayakalpam also, but the Kayakalpam is not just designed for that, but it's like a side effect with lot of goodness in that. So elevating the biomagnetism makes you feel so young and confident and comfortable, so that you will have more time to expire your karmas and also to associate yourself with a causal body and do good to the humanity. So that's how the Kayakalpa is so linked to the biomagnetism. And the Ashwini Mudra, I'm not going to discuss the mudras and the steps in detail because again it will be done wonderfully by our masters in the face-to-face sessions. So the Ashwini Mudra, in medically we can call it as a Kegel's exercise, where we are focusing and contracting the anal musculature as if you are trying to prevent letting out wind in a common place, for example. And the same Ashwini Mudra, if you are doing it in the front end, constricting the urethra, it is known as Vajrolini Mudra. Overall, the whole thing is the pelvic muscles. So why we are doing that? By doing that, our focus of the subtle body goes to the lowermost chakras. By taking our focus to the Mooladhara chakras by the Ashwini Mudra and then behaving with inspiration that the biomagnetism goes up into the higher chakras, we are achieving that good spreading of the biomagnetism to the higher chakras and also creating that nice awareness feeling. So it's very important. In this context, Maharishi has very clearly given us how to improve the biomagnetism in the body. It's very useful for the masters who are doing Diksha, for example, like mirror meditation or the light meditation. There are very clear rules of how to do that, and those who do that, we can easily feel how much we are warmed up and how much we feel brimming with the biomagnetism after those practices, even within few minutes itself. In fact, Maharishi says this Deepa Payirchi, follow maybe every day for the first week or 10 days, but then do it only once a week or do it only once a month. And it's mainly for the masters, because when they are giving Diksha, they are spreading that biomagnetism to the discipline by spending their biomagnetism. So it's very important for them to have more than enough biomagnetism. So now we can understand how much it is important in holding that biomagnetism reserve. Inspiration and focusing is very important. So by using the physical body's movement of the mudra, Ashwini mudra, we are indirectly focusing on the subtle body, and in the subtle body, by the physical body's inspiration, the biomagnetism goes to the higher centers. And all these things, if not handled correctly, or if a person is doing a little bit overzealously in a very active manner, or more than the advised manner, then they can get bit of a discrepancy in the spread of the biomagnetism. That's why people will get with headache, and if not properly addressed, it can cause significant problems in the physical body, including the problems in the blood vasculature in the cerebellum, can result in stroke and can result in quite a catastrophic thing. But fortunately, because of the nicely available masters and assistant professors, I don't think any discipline really got any big untoward effects due to the Kayakalpa, other than the headache, of course. And we know that masters know the techniques of how to reduce the biomagnetism from the higher chakras. That's why we have the clearance meditation and Shanti meditation, so that the magnetism is again spread out, so that you're not getting an untoward side effect of it. In fact, Maharishi used to say the person should learn Shanti meditation before learning the Kayakalpa, because there is no point in having a Kayakalpa, heading into a side effect, and then disturbing the master in the midnight and getting some Shanti meditation. You should know how to handle the side effects before entering into the journey. And then the overall spreading of the energy, your energy is nicely spread in the higher chakras. So we are doing the Keshari Mudra. Again, I'm not going to discuss the Keshari Mudra's details. We can talk even for 1 hour on this Keshari Mudra alone. There is so much of science behind it. So by the Keshari Mudra and Ojas breath, we are spreading the energy to all over the body, up to the fingertips, up to the toes. It's very important you believe and you feel that. Then the biomagnetism is nicely spread out, and it's going to work for the next 24 hours. And then you can further supplement it by doing it 3 times a day, before every drink, before every meal. So as long as you follow Maharishi's technique meticulously in a very understandable manner, you will get the absolute success without side effects. So I don't think you can get this package anywhere. And the Ojas breath, how it happens, because you are creating that purse like lip, and also between your teeth gap. Since you are doing that Ojas breath, it creates the kind of a sprinkling effect, like how you are seeing on this picture, compared to the tap which runs the fluid without much sprinkling effect. You can understand how the sprinkling effect happens. Now you have seen this picture. So when you're doing the Ojas breath, you should feel that you are spreading it all over your body. At the same time, if you just open your mouth and then do the Ojas breath, everything will go out and you won't get the control. So by keeping that purse like mouth, and also between the teeth, you are creating that it's known as a Venturi effect, and then creating that spread all over the body. In my view, even though Maharishi haven't directly linked these things with Kayakalpa, he has made the calorie intake restriction and those things in the Aindil Alava Murai. In my belief, as I said, my presentation revolves around Maharishi's teaching, what is the science, and also what is my understanding. In my understanding, calorie intake restriction is very important. Initially, if you can't really do calorie restriction, you don't worry about the calorie. Just make your meal into like a 2 meal or that 6 hour window or 4 hour window or 1 meal. So try to reduce the window of intake. Don't worry about the calorie. The calorie will automatically be settled down. So fasting, appropriate calorie intake, and the principle of nicely fasting and feasting, which is much more good for your body. This single slide, I can do a absolute science-backed 40 minutes presentation, which we will do on a later date, so that you will understand even the fasting, whatever our ancestors said, has got so much of science backing to that. Possibly they have understood it in a slightly different way, but I am talking to you from the doctor and medical point of view. It will absolutely prevent diabetes, hypertension, hypercholesterol. So with that, we are preventing heart-related problems and problems like stroke, including Alzheimer's disease and everything. It is very important technique to understand if you want to have a healthy body, so that you can spend all your karmas and have a long healthy life. Ejaculation restriction, this is a no-brainer. If somebody is having unnecessary ejaculations, if you understand the whole principle of ejaculation is mainly for childbirth. If you see animals, lion, or maybe something like a cheetah, they don't have sex for pleasure. They have their own seasons and they mate. The mating is happening with the only one purpose of creating healthy offsprings. Unfortunately, it's the human being who found the kick behind this exercise and started using it separately from the producing healthy offsprings, resulting in excessive ejaculation, inappropriate ejaculation. Again, Maharishi has addressed these things very nicely with the Aindil Alavu. This ejaculation restriction applies for men and women. If you want to have an excellent outcome from Kayakalpa, the ejaculation should happen something like once in 2 weeks, lesser, more the outcome. And it slows down the unnecessary energy accumulations in the lower chakras, because the ejaculations and all linked with the Muladhara and Swadhisthana, which are all like lower chakras, and you have more energy available for the chakras of the upper chakras to get energized. I will just take you through some of the medicine behind it, but as you can see, any medical knowledge is predominantly focused on the physical body. If I discuss with my colleagues that there is something known as subtle body, when you're treating a patient, you should also think about the subtle body inside the patient and treat it, means nobody can understand, because it is not in the medical curriculum. But indirectly, that's what we do. If a patient comes, we have empathy, we feel sorry for the problem, and if they feel a bit low mood, we try to help them. So that's what the communication happens between the subtle body. But predominant focus is happening on the physical body. If there is a swelling, cut it. If there is a burning, put some ointment. So the focus is predominantly on physical body, which is where the modern allopathy medicine fails, in spite of lot of research and everything going on. The problem in our ancient Ayurvedic or homeopathic medicine is there is a good focus on the subtle body, but there is no real science backing to it. So if somebody wants to know a little bit about what is the physical body equivalent of what we have discussed till now, you need to know about the cranial nerves, of which, as you saw in this picture, the 10th cranial nerve, vagus, is very important. It is started from the medulla and it travels all over and supplies from the heart, bronchus, stomach splanchnic nerves, and liver, pancreas, adrenal, small intestine, large intestine. So such a large group of organs throughout the thorax and abdomen is shared by the 10th cranial nerve, which is a parasympathetic nerve. The whole Kayakalpa exercise will strengthen your parasympathetic, so you will have a reduced heart rate, reduced blood pressure and calmness, while stimulates the parasympathetic and reduces the sympathetic tone. That is the whole purpose of the exercise if you want to learn from the physical body equivalent. And so the strengthening the 10th cranial nerve is the most important one, and you can strengthen the 10th cranial nerve by the other methods. Even the simple Kesari Mudra, which I said, that strengthens the glossopharyngeal nerve. The glossopharyngeal nerve, which is a nerve 9, and vagus nerve 10 are very closely related in their origin and the traveling area. So once with the Kesari Mudra, you are strengthening the glossopharyngeal nerve. Indirectly, the vagus nerve also will get nicely strengthened. And coming to the lower areas like our Ashwini Mudra, the nerves involved were the S2, S3, S4 segment in the sacrum, which is known as the pudendal nerve. And this is the pudendal nerve in the pink nerve in the pelvis. It has two sides, right side and left side. And this is the pelvic muscle which I discussed. So in the back, when we are constricting the anal muscle, it is known as Ashwini Mudra. If you are trained and doing the constriction of the anterior pelvic floor, it is known as Vajrolini Mudra. And indirectly, if you do Ashwini Mudra, we all will constrict the front also, because they are all in single pelvic floor. And in this picture, I just removed that important pudendal nerve. You are seeing all other organs like large intestine, testes, seminal vesicles, bladder, everything. If I just go to the next slide, you can understand the pelvic nerve. So the pelvic nerves literally disperse all throughout the lower part of the pelvis, pudendal nerve, and it supplies quite heavily to the musculature. See, this muscle, pelvic floor muscle, is the only area where you have the voluntary control. That's why we are doing that exercise, to keep the subtle body focus on the lower chakras and take the energy from there and spread it to the higher chakras by using the inspiration and by using that bhavana, which is you should feel that, you should believe, and you should behave as if the energy is happening. Believing is the important part of it. And the energy goes up. These are the three main nadis. So the center one is a Sushmana nadi, and then we have the left side, which is Ida, and right side is Pingala. And if you want to know the equivalent in medicine, the left side Ida is equivalent to the parasympathetic, and the right side Pingala is equivalent to sympathetic. So our aim is to reduce the sympathetic tone, improve the parasympathetic, and they all join together at Agna. After Agna, there is only Sushumna Nadi is going on. So that's why, as long as you are strengthening up to the Agna, your Aganmya karmas are nicely balanced. That's what we saw last time. If you are able to have the meditation in the Turiyam, your Prarabdha karma also nicely balanced out. If you are able to meditate at Turiyadidam, even the Sushumna Nadi is ending there. So you will be completely free of everything, including the Sanchita karma. So I'm just bringing the revision from the last week's session. And this is how the chakras were nicely spread along the nadis. And the area which is very important, the reason why I really brought this picture is people always concentrate on the pituitary and pineal gland, because that is a structure which can be easily demonstrated. And I feel equally the one which is forgotten is the midbrain. So midbrain is the one which is like a pacemaker for our heart rate and breathing rate. Midbrain is the one which has a lot of associative areas like optic associative area, auditory associative area. So without the midbrain, what happens is the whole brain will hear, see, will assimilate, but will never understand. So the whole understanding happens in the midbrain. It is closely associated with the limbic system, which is what the fear and frighteningness, etc. So once you do a proper Agna Chakra, understand the science behind it, you will reduce the unnecessary fear. The outside happenings which supposed to create fear will still happen, but you will be as cool like a cucumber. That's the science behind it. So we have finished the science behind Brahmanyanam and science behind Karma last week, and today we have finished Kayakalpa. So there are so many sessions to finish, like what is the science behind fasting, pranayama. Regarding that, Rajan Master has very nicely mentioned about this breathing technique, what is the importance behind it in one of the session 2 weeks back. But I'm going to focus more on the science behind it. What is happening in that period where we are holding the breath? What is happening in that expiration? What type of nerve cells are stimulated and why it is giving us the longevity and health? There is a definite medical science behind it. And science behind the meditation, Surya Namaskars, Yogasanas, and our Varth, what are all the science behind it, we can discuss in the future weeks. And my sincere thanks to Swamiji Maharishi, who has given us this wonderful tool, and my special thanks to the masters who has taught me and initiated me, and I'm quite happy to answer any questions. Thank you very much for the opportunity.
Any questions for Dr. Ananda? Anyone?
Hello, Dr. Ananda. I have just one question. A very nice presentation.
Thank you.
You said the 10th cranial nerve controls most of the internal body organs. And is that the nerve continues to the pelvic region as well, which creates the voluntary movement?
Yeah, so 10th cranial nerve starts, as I said, from the medulla. It's the vagus nerve. The vagus, the meaning itself is known as wandering. So it is such a long nerve, longest cranial nerve, and it wanders through so many organs. So that's why it's known as a wandering nerve. And we have two nerves from both sides which supply so many organs. It is a cranial nerve. It is a parasympathetic nerve. The voluntary muscles are from the sacrum. So if you take the whole cranium, thoracic, lumbar, sacrum, the spinal cord is divided into 4 sections. The cranial part and the sacral part are parasympathetic. The thoracic part or the cervical part and the lumbar part are sympathetic. That's why when you get any fearful situations or something, we say my stomach burns and I got like a palpitations and I get a butterfly feelings. Everything happens in the thorax and the abdomen, so they are all sympathetic part. So the whole practice depends on strengthening your cranial output, strengthening your sacral output. Cranial output is through the vagus. The sacral output is through S2, S3, S4, which is the pudendal nerve. That's why I showed the pudendal nerve separately. So pudendal nerve is a voluntary nerve which you can control, and it also acts by its word. Vagus nerve you can't control. Vagus nerve is an involuntary nerve. The only way you can control that is by appropriate food intake. For example, if your tummy is having a nice sattvic food, if you are maintaining a good biology in the tummy, that's where you are getting the good input from the vagus. There are so much research which has proven that if your food is good, if your tummy microbiome is good, the vagus reverse input or the feedback from the vagus is good, and that will help preventing Alzheimer's disease, age-related cerebral atrophy, etc. So the vagus nerves becomes the main link between any age-related cranial problems and the microbiomes in the tummy.
Okay, so there is a connection between microbiome and the cranial nerve senses. Yes. Okay, so the Kayakalpa exercises is as we know, the sacral part, it's strengthening, and also by doing the mudra and getting the energy to the upper floor, we are strengthening the cranial nerve also. So by that way, it connects with the nervous system and the shuttle body and increases the health. Is that what you mean, right?
Exactly. So the Ashwini Mudra makes us to focus the lower chakras in subtle body, and then also it creates the churning effect, as Maharishi says. Because of the churning effect, you are getting a good amount of activity happening. And then if you use your belief and inspiration to take the biomagnetism to the higher chakras, we can say that the vagus is the equivalent in the physical body which takes the biomagnetism to the higher chakras. But as I said, the main reason why the English medicine or allopathic medicine is not able to tick the boxes is they want to work it out purely through the vagus nerve and pudendal nerve. The buck stops there for them. But we won't be complete. We should understand there is something known as subtle body. It is a simple thing. Say, for example, I may have a very painful thought in my mind, like I may have lost 100 pounds or something like that. Very trivial thing, but I can still smile. And if you see me, you don't know what's happening in my thought. You may be saying, oh, Ananda is happy. So what you're seeing is only my physical body, while the subtle body is in unhappiness. So there is a definite entity of subtle body. If our Western allopathy medicine is able to understand this, we can give a wholesome treatment to any disease happening with the patients, and the outcome is excellent. I can't practice this openly in my NHS practice, but For many months, if a patient comes to my door, I approach them in this manner within my heart, and there is no words to explain the improvement in the patient's disease, and they thank what they do profusely, because by this I'm able to tickle the areas which the other doctors can't do. That's the beauty of it. And I really want to, this is an open resource, I really want the other doctors to understand this, but I got a lot of opportunity in my hospital to present these things, but it will be taken up with some skepticism, that it's up to them, it's up to their individual karma how far they can understand this. But if I relate my allopathic medical knowledge with what Maharishi has thought, I can see it just matches one to one so correctly. It fits like they say, like the hand fixing into the glove.
All right, that makes sense. Thank you. Ananda,
can I come in?
Yes, please, Shivakumar.
வாழ்க வளமுடன் ஆனந்தகுமார். Very nice, clear, concise, simple presentation. I just want to emphasize on two things which should be the take-home message. One is the bhavanai. The other one is the belief system in our guru with various sort of teachings and other things. So those two are important words for me, which is bhavanai and the belief system. Thank you. வாழ்க வளமுடன்.
Absolutely. Because the bhavana is the one which is handling the subtle body. Without bhavana, there is no the subtle body, you can reach only by bhavana, and also the belief. I will say bhavana is very important, there is no doubt in it. Belief regarding that, you can handle it with some skepticism, nothing wrong in it. Everybody will question when you are buying a carrot or a brinjal in the market, we question it, so there is nothing wrong in questioning it, but you can't question throughout your life and lose your life. Question it, research it, contact with appropriate masters, and then get relief with appropriate scientific background. Now the whole Maharishi's concept, if you look into even the vision curriculum, we are slightly moving away from saying like, this is what Maharishi said, believe it. That's fine, but at the same time, this is what the science behind it, so you don't have to just have the faith, you can understand it also. So this is the second part of it. If I quoted about the group of people who practiced taking this karpam, and unfortunately it's not very successful. As I said, 40 people enrolled, 30 people fallen apart without any reason. Of the 10 people also, only some 2 had some small changes, but not very brilliant. 8 people haven't had enough improvement in using the karpam. The main reason, when I discussed with the scientific people, they are all doctors, they are all big people, they are not just lay people trying this karpam. The main reason what they said is, number one, we are not able to produce karpam as authentically as historically prepared. Number two, we don't have the ingredients, we don't know how to go to the forest to find them. Number three, there is no belief. As you correctly said, Shivakumar, the belief is not there. So even if you have the correct karpam in correct dosage with correct lifestyle practices, if you don't believe it, it won't happen. The belief and the bhavana are all related to the subtle body. So subtle body is only believing. If I believe that this water is pure, I can drink. Do you think my physical body is believing it? It's my subtle body is believing it. So if you want to feel the subtle body, that's where these things are coming in. Nicely summarized. Thank you, Shivakumar.
Yeah, absolutely. I mean, that's why Maharishi has told Sollal matrum nambade suyamai sindithe telivai. So it clearly brings even in his prayer song that just don't believe what I say, just research and find yourself out what's happening here. Thank you. Thank you very much.
Absolutely. If you see Sakti's presentation, in every presentation he will say, don't take my words alone, just research it further and take it with your own research. That's what Shakti usually mentions.
Yeah. Thank you. Thank you very much. வாழ்க வளமுடன்.
வாழ்க வளமுடன்.
வாழ்க வளமுடன்.
Thank you, Dr. Ananda. Well presented, and you made it very simple as well. Anyone wants to add any comments or compliments? Please. இல்லைன்னு சொன்னா உலக நல்ல வேர்ப்பு சொல்லிடலாம். Harry, because it's a bank holiday.